Well, the evening medical bulletin for the state of Karnataka is out. As per the noon bulletin, we have seen 425 cases. And as per the evening bulletin, the number of positive cases in Karnataka has risen to 427. So 2 more cases have been added. 7 plus 2, we're talking about a total of 9 positive cases of COVID-19 that have surfaced in Karnataka today. 17 deaths have been reported so far in the state. Fortunately, no deaths reported today. But yes, we're talking about 9 positive cases that have been reported. 7 positive cases were reported in the first medical bulletin that came out during the noon time, and 2 more positive cases surfacing in the evening bulletin, taking the total number of positive cases for the day to 9, and the total number of positive cases so far for the state of Karnataka standing at 427. Now, out of those 7 positive cases, 7 earlier positive cases that we were speaking about, 5 of them happened to be from Kalaburabi and 2 were from Bengaluru urban. We'll just get you that information as to where the 2 new positive cases have emerged from and what those case details are, what the contact history is, what the travel history is. But yes, we're talking about total of 9 cases that have been reported today across the state of Karnataka. 17 deaths reported so far, and total number of cases in the state has risen to 427. Well, we're talking about how in the medical bulletins even cases of SARI have emerged, that is a severe acute respiratory illness that emerged today in the earlier medical bulletin. So it remains to be seen if there are any more SARI cases out of the 2 new cases that have been reported in the latest medical bulletin, and whether these 2 cases are from Kalaburabi itself or maybe Bengaluru, or if Mysuru has made its presence felt once again with the Jubilant Pharmaceutical Company. The number of cases that are only on the rise. There you have it, 2 cases reported from Bengaluru, 2 from Mysuru, and 5 from Kalaburabi. So there you have it. The other 2 cases, as we were just discussing, happen to be from Mysuru. 5 from Kalaburabi, 2 from Bengaluru city, and 2 from Mysuru. A total of 9 cases of COVID-19 reported in Karnataka today, taking the total tally of the number of positive cases across the state to 427. 5 patients are currently in ICU. That's the latest bit of information coming in as to how 2 new cases of COVID-19 have emerged in the latest medical bulletin. Both of them happen to be from Mysuru, and in all likelihood, it may as well be to do with the Jubilant Pharmaceutical Company, or if there may be a Tablighi link. If there were contacts of attendees of the Tablighi Jamaat event, we will get that information for you in just a bit. But yes, we're talking about 9 cases that have been reported today from Karnataka, 5 from Kalaburabi, 2 from Bengaluru urban, and 2 from Mysuru. 5 patients, in fact, are in ICU at this point in time. Nine new cases of COVID-19 have surfaced in Karnataka, out of which 5 are currently in ICU. Now, out of the 9 new patients, 5 are from Kalaburabi, 2 are from Bengaluru urban, and 2 are from Mysuru. For more on this, I'm being joined in by my colleague Neha, live from the newsroom. Neha, we know details about the first 7 patients, in fact, came out too light when it comes to the earlier medical bulletin. What about the 2 new patients? They are from Mysuru. Is there a Tablighi angle, or is this something to do with the Jubilant Pharmaceutical Company? Give us more details on the 2 new cases.
Right, Adarsh, it does appear that more or less these cases have to do with the Jubilant Pharma Company, as you rightly mentioned. Let me just give you the patient history here. We have 2 new cases, and patient number 426, a 56-year-old male from Nanjangud, Mysuru. Again, he's contracted the virus from patient number 383. Then you have patient number 427, who's a 32-year-old male from Nanjangud, Mysuru. He has again contracted the virus from patient number 52. Do remember that patient number 52 was working in Jubilant Pharma Company, and he alone has infected several people in Mysuru. And with this, the total number of positive cases in Mysuru alone has risen to 88. The situation absolutely is worrisome. You know, on one side, several of the health experts are of the belief that India still still has not stepped into phase 3, which is community transmission. But having said that, we have had several positive cases where many people have tested positive. They had absolutely no travel history, and from where they contracted the virus, those people also did not have a travel history at all. So now let me just quickly give our viewers a brief. Total of 9 positive cases have been reported from Karnataka today alone. Talking about patient number 419, right on our screens we can see the details of the fresh cases. A 54-year-old male from Bengaluru urban. Yes, for 3 consecutive days Bengaluru did not report any positive case, but having said that, today we have 2 cases from Bengaluru urban. With this, the positive cases in Bengaluru also has risen to 91. Talking about patient number 419, a 54-year-old male from Bengaluru urban. He's suffering from severe acute respiratory infection and has been isolated at a private hospital in Bengaluru. Now talking about patient number 420, it's a 28-year-old female from Bengaluru urban. She's contracted the deadly virus from patient number 208. So here, it's a widespread notion, as I've been saying throughout, that coronavirus can only be contracted by those who are above the age of 60, but putting to rest all of those rumors, all of those myths, if I can call it, there you have it, a 28-year-old female also contracting the virus. But what is shocking is that I would like to draw the viewers' attention to patient number 24, a 4-month-old male, also a 4-month-old infant from Kalaburabi has also contracted the virus from patient number 395. We're going to go to that, but let's just quickly come back to patient number 421, a 46-year-old female, again from Kalaburabi. This time you have 5 new cases from Kalaburabi district. She again has contracted the virus from patient number 222. Talking about patient number 422 now, a 57-year-old male from Kalaburabi. He is suffering from severe acute respiratory infection and has also tested positive for the deadly virus. Patient number 423, a 35-year-old female from Kalaburabi. She again has contracted the virus from patient number 395. Now let's quickly go to patient number 424. That's where I would like to draw attention of all our viewers. A 4-month-old infant. He has contracted the virus from patient number 329 and has been isolated at a Kalaburabi hospital. Till now we have had cases as young as 1-year-old, as young as 9-year-old who had contracted the virus. But this time, for the very first time, we have a case from Kalaburabi where a 4-month-old infant also has tested positive for the deadly virus. Talking about patient number 426, as I mentioned earlier, these are the 2 fresh cases from Mysuru alone. Patient number 426, a male from Nanjangud of Mysuru. Patient number 427, a 32-year-old male from Mysuru. Again, he has contracted the virus from patient number 52. If I have to talk about patient number 425, beg your pardon, I skipped that. She's a 26-year-old female from Kalaburabi and has contracted the virus from patient number 395. So with this, the total number of positive cases in Karnataka stand at 427. This includes 17 deaths, 131 discharges. So right now, of course, if you compare the situation of Karnataka with several other states, those being of Maharashtra, where we're seeing a steep increase in the number of COVID-19 cases, yes, the situation pretty much is in control, but that does not mean that the threat has subsided. We all need to practice social distancing. We all need to stay indoors and do our bit for those who have been risking their lives there up front.